This video briefly talks about COVID-19 in the state of Florida at the intersections of race and ethnicity in Highleaf. This is a city in Florida. Before we talk about Highleaf, let's talk about Florida in general. And this is obtained from this news article below. I think this news article was posted yesterday, and you can still Google the name. So, this is part of the news article clippings. As the coronavirus spread across the nation, Hispanics, African Americans, and seniors are falling sick and dying in disproportionate numbers. The stakes are high in Florida, where 1 in 5 is aged over 65, and pockets of states are deeply rooted with Cubans, Haitians, and other minorities. So, we see the concept of intersectionality being portrayed in this news article. We see how somebody's racial group interacts with his or her age group to affect a person's health outcome in this case. This is what we mean by intersectionality. We all know that different dimensions of inequality, whether it is race, gender, age, education, income, and so on and so forth, they interact and intersect to affect a person's life outcomes in different domains like education attainment, occupational success, health, and so on and so forth. This is what we mean by intersectionality. So, as we can see, a person's age intersects with a person's race to affect a person's outcomes here. We may also see a person's racial ethnic groups interacts with a person's immigration status, whether the person is first generation immigrants, 1.5 generation immigrants, second generation immigrants, or so on and so forth. This is what we mean by immigration status. When we talk about 1.5 generation, we mean the person came to the US as a child and grew up in the US. This is what we mean by 1.5 generation. So, as you can see, Hispanic and the black people in Florida, some Hispanics may be first generation, and some may be 1.5 generation, and some may be second or third or fourth generation. So there's an intersection of race and immigrant or immigration status here. The same thing for black. Black people can either be born here, or they've been here for generations, or they can be immigrants. So another manifestation of the intersection of race/ethnicity and immigrant status. Are we clear? So you can Google this news article. Okay, if you Google the location of Hialeah, I don't know how to pronounce, I'm sorry, and this is what you are going to find. Here is the location of Hialeah in Florida, and here is the population of Hialeah in Florida from the 1930s until recently. And we see that This here live is characterized by rapid population growth from the 40s until the 60s, and then the rate of population growth slows down from the 70s until now, and at the latest 2010 census, they registered a negative growth. But we see cumulative effects of population growth in Hialif from the 1940s until the 2000-ish. So maybe because of that, it remains one of the very populated cities in Florida. And because of that, they registered some confirmed cases of the coronavirus. So if you do a search on Hialif, just on Google or anywhere on Bing, Safari, and it will take you to many websites, government websites or Wikipedia. And these are the racial composition and population composition of Hialif. As you can see from this table from Wikipedia, based on the 2010 census, the population in Hialif is more than 220,000. I'm sorry. And they experience a slight decline in growth. And on the right side of this slide is the news article clippings. It says that it has a high concentration of Hispanic, which is quite true from this table. I think they are predominantly white Hispanics. They are more than 90% of Hispanic ethnic groups, and they are also more than 90% of the Caucasian race. So this can mean that the majorities of the people in Hialif are white Hispanics. And based on what's described in the news article, it seems that the people living in Hialif, the white Hispanic, they may not be very well off. The majority of them live in public housing. And because of that, they are susceptible to infection. And because of that, maybe relative deprivation is manifested among the white Hispanic population in Hialif. They may lack the necessary resources to prevent getting infected or even getting tested. And living in public housing is another indication that this white Hispanic group may be underprivileged, and maybe because of their language and cultural barrier, they cannot assert their rights to health care, especially if they came to this country as first-generation immigrants. They are not familiar with the mainstream healthcare system. And because, according to this article, the Hispanic population in this city are highly susceptible, this can also imply that there is some kind of social-economic gradient in health, because living in public housing is a given. It means that, or it implies that, they are not very well off. So we see a health and healthcare disparities being manifested in this piece of news. Because according to the table on the left, it seems that Hialif are predominantly white and Hispanic, and it is logical to assume that they can be white Hispanics. So, from the percentages shown on this table, maybe there are some sort of residential segregation and social exclusion and isolation in Hialif due to their language and cultural barrier, especially if they are first generation immigrants. They are not aware of how to go get tested if they experience some symptoms, or given the nature or the status of their employment, they may be less inclined to seek care or to go get tested even if they experience some symptoms. So because of that, we see an intersection of race/ethnicity and immigrant status in Hialif, as depicted by this news article. So, the local and state government in Florida issued a stay-at-home order in Hialif a while ago, and they also locked up churches and other public places. Is that sufficient to prevent the spread of coronavirus, or do they need to do something more? And if you just go to Census Quick Facts and you type in Hialif City, and they will give you different socio-economic measures, including income and poverty for Hialif and for Miami-Dade County in general. So, if you compare these two columns, it seems that relative poverty, you can Google this word and you can read about the definition of relative poverty from various websites, legit websites, hopefully. So, the concept of relative poverty is being portrayed in Hialif City. As you can see, their median household income is somewhat lower than the county in general. The same thing for their per capita income. And the percentages of population living in poverty for Hialif City is somewhat higher than the Miami-Dade County in general. But there are two kinds of poverty. We talk about the relative poverty, and there's also another kind of poverty. We call that the absolute poverty. It is a condition where household or individuals' incomes are not enough to sustain their basic needs like food, clothing, shelter, and so on. And it's not clear from the official statistics whether people living in Hialif City experience absolute poverty as well. But we know, according to this news, they are susceptible to the spread of this virus because majority of them live in public housing. And let me introduce two more concepts to you: the cultural capital and the social capital. Sometimes the cultural and social capital can also determine a person's life outcomes, be it education, occupation attainment, income, and health. So, what is cultural capital? Cultural capital is essentially the know-how. It pertains to our taste for wine, music, art, movie, and so on. cultural capital can also be our intellect, our expertise, knowledge, skills, how we dress, how we talk, how we carry ourselves, how we interact with others, our mannerisms. And cultural capital determines how cultured we are or how culturally competent we are. And what is social capital? Social capital pertains to one's social network, who we know, who we interact with on a daily basis. And because of our cultural capital, we are more inclined to mingle with those who share the same cultural capital like us. I'm sure you heard of this phrase, birds of the same feather flocks together. So, oftentimes we mingle with others who share the same sets of cultural capital like us. And because of that, our cultural capital determines our social capital. This in turn determines our healthcare access, quality of healthcare we are going to get, and other life outcomes. So, in the previous slides, I asked you this question: whether issuing stay-at-home orders and locking up public places are sufficient, or do we need to do more? And people in Hialeah City, as being depicted in the news article, they live in public housing. So we see a socio-economic gradient in health. We see disparities in health or healthcare access when we compare Hialeah to the county in general, or when we compare Hialeah to other cities in Florida. We may see people in Hialeah are underprivileged to some extent, maybe due to their language and cultural barrier. So, is merely closing churches, closing public places, issuing stay-at-home orders, are they sufficient, or do we need to find a way to get people, Hispanics especially, living in Hialeah, access to care? Do we need to do something more to bridge, to circumvent their language and cultural barrier, if they have any, so that everybody can have the opportunity to get tested and treated for coronavirus, ideally? Do we need to do more? Do we need a culturally adapted screening, diagnosis, and treatment to circumvent the existing language and cultural barriers among the people living in Hialeah? If you Google that news article, I did not clip every section of the news, but if you read the entire news article, it seemed to me that the local and state government are quote-unquote blaming the people living in Hialeah for their culture and lifestyle. It seems that the government assumed that given their cultural traits, they like to gather, and that's another reason why they are more susceptible, aside from how they live. So, do we need collaboration among entities like medical associations, community groups, government, NGOs, and private sectors maybe, to jointly develop a preventive mechanisms that caters to the distinctive culture of the people living in Hialeah? And Maybe we should promote these preventive initiatives and strategies in terminologies the people in Hialif can understand. In other words, should we come to their level when we promote these testing mechanisms, treatments to people living in Hialif? And I forgot to mention earlier, from the table we saw from Wikipedia, and they got it from the 2010 census, it seems that people living in Hialif, they are exposed to some kind of health risk in here because they live in public housing. So, environmental justice is also involved in this news. So, should we revise the existing intervention or message to promote testing and treatment by taking the cultural elements of people living in Hialif into account when we devise strategies to promote testing among these people living in Hialif?